Hey everyone, and welcome to a deep dive designed just for you. We'll be looking into end-of-life care training for certified nursing assistants, specifically from the California Community College's curriculum.
Oh, interesting.
Yeah, and we're gonna, deep dive into the emotional side of caring for people nearing the end of life,
Right.
and all the practical skills CNAs need, plus a really fascinating exercise called the timeline of life. So are you ready to jump in?
Absolutely. Let's dive in. I think it's really great how this curriculum tackles the tough emotional stuff head on. Death is a part of life, and this training seems to really embrace that.
It does, and it starts right off with Kubler-Ross's stages of grief.
Oh, yeah, the denial, anger, bargaining, depression, and acceptance.
Right. But it's not just a theoretical list.
Yeah.
It connects these stages to what CNAs might actually experience on the job. Like, say a patient is lashing out at the staff. That could be the anger stage coming through, or a patient who's fixated on seeing their grandchild one last time. That might be bargaining.
It's so true. And, recognizing those stages can help CNAs respond with more empathy and understanding, because it's not just about the tasks.
Right.
It's about connecting with the person behind the illness.
Exactly. Seeing the human being, not just the patient. And that leads into a really powerful part of the curriculum, the dying person's Bill of Rights.
Oh, yes, I love that part.
It outlines the rights of a dying person to be treated with dignity, to maintain hope, to express their feelings openly,
Yeah.
and to be involved in decisions about their own care.
I find that part really compelling because it puts the focus on empowering the patient to make choices, even when facing a terminal illness.
It's about respecting their autonomy. But is that level of autonomy always achievable in practice? There are often really complicated medical situations and family dynamics at play.
That's a really good point. And while it's definitely the ideal, there are absolutely real-world challenges. But this Bill of Rights acts as a guiding principle,
Yeah.
a reminder to put the patient's wishes first and involve them in decision-making as much as possible.
It sets a high standard for compassionate care. Now, the curriculum also covers those practical skills a CNA needs, like recognizing the signs of approaching death and providing comfort measures, and those difficult conversations with patients and families.
Absolutely. Those skills need a balance of technical expertise and emotional intelligence. Take postmortem care, for example.
Yeah.
It's a specific procedure, but it also requires a deep level of sensitivity and respect.
It's a final act of care, right?
Exactly. Honoring the person's dignity even after death.
Now, there's one part of the curriculum I'm really curious about. It's the timeline of life exercise. What's that all about?
Well, it's designed to help people understand and empathize. Imagine plotting the big events in your life on a timeline, from birth to now, celebrating achievements, relationships, everything that makes up a life.
Yeah.
Then imagine getting news of a terminal illness.
Wow.
How does that change your perspective on the timeline?
I can see how that would be powerful, forcing you to really face your own mortality.
Exactly. And for CNAs, it helps them connect with what their patients might be going through emotionally, allowing them to provide better care.
So it's not just about learning procedures, it's about understanding the human experience behind it.
Exactly.
Are there any stories in the curriculum about how this exercise has impacted students?
I haven't seen specific stories in the material itself, but I've heard from instructors that this activity often sparks really deep conversations and reflections. It seems to resonate with students on a personal level.
That makes sense. It's not just about the steps in a procedure, but the human element. So besides this timeline of life, what other interesting or surprising things did you find?
Well, there's a whole section dedicated to hospice care. I thought that was really insightful. It explains the goals of hospice, which focuses on comfort and quality of life rather than seeking a cure.
So it's about making the remaining time as meaningful and comfortable as possible.
Precisely. And it highlights how important a multidisciplinary team is, with doctors, nurses, social workers, and of course, CNAs.
Everyone working together.
Each playing a vital role in providing care to the patient and their family.
And the curriculum covers the specific things a CNA would do in a hospice setting, right?
Yes, it does. And it goes beyond just physical care tasks. It really emphasizes the emotional and spiritual support that CNAs offer.
Which can be so important during such a sensitive time.
Absolutely. CNAs are often the ones spending the most time with patients, building relationships, and providing comfort.
That's a huge responsibility.
It is. And the curriculum recognizes that by giving CNAs the knowledge, skills, and emotional awareness they need to provide truly person-centered care. It's about seeing each patient as an individual, not just a medical case.
This approach seems to be about humanizing the dying process for both the patient and the caregiver.
Exactly. Recognizing that even in death, there's a need for dignity, compassion, and human connection.
And this curriculum seems to do a remarkable job of conveying that. I'm curious about the sample test section. Does it give you a sense of how this knowledge is actually tested?
It does. And it's full of these real-life scenarios that a CNA might face. It brings everything to life.
Interesting.
For instance, one question asks how to respond to a patient who's yelling at the staff.
Okay.
And the answer stresses recognizing that the patient might be experiencing anger, a stage of grief.
So it connects back to those core concepts we've been talking about.
Exactly.
It's not just memorization. What other types of scenarios does the test cover?
Oh, all sorts. Recognizing the signs of approaching death, knowing what comfort measures to provide, supporting a patient's family. There's even a question about handling a patient's religious items with respect, highlighting cultural sensitivity and honoring individual beliefs.
It sounds incredibly comprehensive, so we've covered quite a bit.
We have.
The stages of grief, the dying person's Bill of Rights, practical skills, the timeline of life, hospice care, even the sample test. What's your overall impression of this curriculum so far?
I'm seriously impressed. It goes beyond just training CNAs to do tasks. It gives them the emotional intelligence and ethical awareness to provide truly person-centered care, recognizing the humanity in death and dying.
I completely agree. This training is clearly designed to create caregivers who are not only skilled, but compassionate and empathetic.
Definitely.
It's not just a job. It's about making a real difference in people's lives, even in their final moments.
Exactly. And that's what makes this module so impactful. It reminds us that death is a natural part of life, and it deserves the same care and respect as any other stage.
It's about acknowledging the emotional and spiritual weight of the experience for both the patient and the caregiver.
Precisely. And in my opinion, this curriculum does a fantastic job of preparing CNAs to navigate that complexity with sensitivity and grace.
Well said. Now, you mentioned earlier that the curriculum focuses on hospice care, but I'm curious if it addresses any other end-of-life care options.
It does touch on palliative care briefly.
Okay.
Palliative care can be given alongside curative treatments, and it focuses on managing pain and symptoms to improve quality of life.
That's important to distinguish. Palliative care isn't just for end of life. It can be offered at any point during a serious illness.
Exactly. The curriculum acknowledges that palliative care and hospice care often overlap but have different goals.
So it's giving CNAs a broader view of the options available.
Yes, and it really emphasizes understanding the patient's individual needs when discussing these options.
Empowering them to make choices about their care.
Right.
Whether it's pursuing curative treatments, focusing on comfort, or exploring hospice care.
Exactly. It's about a patient-centered approach, recognizing that there's no one-size-fits-all when it comes to end-of-life care.
Now, how does the curriculum address talking about these sensitive topics with patients and families? Are there guidelines for navigating those conversations?
Oh, definitely. It stresses clear and compassionate communication, using language that's respectful and easy to understand. CNAs are encouraged to listen actively, to acknowledge fears and concerns, and to offer support and reassurance.
It sounds like it's about more than just conveying information, but creating a space for real dialogue.
Exactly. It recognizes how emotionally charged these conversations can be and the sensitivity needed from the caregiver.
Does the curriculum give any specific tips for handling those tough moments?
It suggests using open-ended questions, to encourage patients and families to express their feelings and worries.
Right.
It emphasizes nonverbal communication, too, like maintaining eye contact or offering a comforting touch to show empathy. And it encourages CNAs to be aware of their own body language and tone, to project calmness and reassurance.
So providing a toolkit for communication that's both effective and compassionate.
Exactly.
Which is essential for building trust during such a challenging time.
Absolutely. It's recognizing that communication isn't just about words. It's about creating a safe space for honest dialogue to occur.
You mentioned earlier the importance of cultural sensitivity. Can you talk about how the curriculum addresses that?
Sure. It really emphasizes that CNAs need to be aware of and respect different cultural beliefs and practices around death and dying. They're encouraged to learn about customs and rituals that are important to their patients and families.
So going beyond a one-size-fits-all approach, recognizing that end-of-life care should be tailored to each person's background.
Exactly. Death and dying aren't experienced in a vacuum. Beliefs about the afterlife, mourning rituals, preferences for medical interventions, They can all vary a lot between cultures.
It sounds like the curriculum is really encouraging CNAs to be culturally competent, providing care that's respectful and responsive.
Precisely. Culturally sensitive care isn't optional. It's a core part of quality end-of-life care.
This whole exploration is eye-opening. The curriculum really emphasizes the emotional and spiritual dimensions of caregiving, not just the practical stuff.
It's true. They're preparing CNAs to be more than task-oriented.
Right.
They're helping them become compassionate companions, advocates, and sources of support for patients and families going through a tough time.
It's a holistic approach that acknowledges how complex the human experience is at the end of life.
Precisely. It's about understanding that dying isn't just a medical event, but a deeply personal and emotional journey.
Well said. We've covered a lot in this first part of our deep dive.
We have.
The emotional and practical aspects, the role of the CNA, some of the unique parts of this curriculum.
Yes.
But there's so much more to explore.
Absolutely. In the next part, we'll go even deeper into some of the harder topics around death and dying, including the emotional toll it takes on caregivers and the ethical considerations that arise.
That's going to be a fascinating conversation. We'll see you there. Welcome back to our deep dive into the California Community College's curriculum for CNAs focused on death and dying. It's going to be interesting to explore some of those more sensitive areas we touched on earlier,
Right.
like the emotional challenges for CNAs and the ethical dilemmas in end-of-life care.
Yeah, those are really important parts of the training. Caring for dying patients can be incredibly rewarding, but it also takes a toll emotionally.
The curriculum addresses that, doesn't it? It's not just about procedures, it's about preparing them for that emotional reality.
Absolutely. There's a section that deals with compassion fatigue and burnout,
Right.
which are so common among caregivers, especially those working with terminally ill patients.
Yeah.
It really emphasizes self-care,
Yeah.
seeking support from colleagues and supervisors, recognizing those signs of emotional exhaustion.
That's got to be so important. I mean, witnessing suffering and loss day after day, that must take incredible strength.
It does. And the curriculum encourages CNAs to find healthy ways to cope,
Okay.
whether it's through mindfulness, talking to a therapist, or just taking time for themselves.
It's about recognizing that it's okay to feel overwhelmed sometimes, to feel drained.
Exactly. It's normal. And then that ties into the ethical considerations, too. When you're dealing with life and death, there are bound to be ethical dilemmas.
Like, what kinds of dilemmas come up?
Well, imagine a patient in a lot of pain who wants more medication, even though it could speed things up. Or a family member who insists on continuing life support, even though the patient has said they want to let go. These are tough situations with no easy answers.
So how does the training help CNAs deal with those gray areas?
It really emphasizes open communication,
Okay.
both with the patient and the whole healthcare team. It encourages CNAs to advocate for the patient's wishes while respecting the medical expertise of the doctors and nurses.
So finding that balance between being a compassionate advocate and recognizing the limits of their role.
Exactly. Being a voice for the patient, but also working within the ethical and legal guidelines.
It sounds like the curriculum is trying to build that ethical awareness in future CNAs.
It is. It recognizes that CNAs are often right there on the front lines. They see those intimate moments and make decisions that have a real impact. It gives them the tools and knowledge to make those decisions with compassion and integrity.
And now earlier we talked about the Dying Person's Bill of Rights, which focuses on patient autonomy. But are there ever times when those rights conflict with what the family wants or with the medical team's judgment? How does the curriculum handle that?
That's a really good point, and it does acknowledge that those situations can happen.
Yeah.
It emphasizes open and honest communication among everyone involved, and it encourages CNAs to be that link between the patient, the family, and the healthcare team,
Okay.
helping everyone talk to each other and hopefully find some agreement.
So fostering collaboration and understanding, not just pushing one perspective.
Exactly. It's about recognizing that everyone is coming from a place of care, even if they don't agree.
What about when everyone can't agree? Does the curriculum give any guidance on what to do then?
It stresses the importance of following the set protocols
Okay.
and seeking guidance from supervisors or the ethics committee and documenting everything carefully to be transparent.
It's like a system of checks and balances to make sure ethical considerations are always front and center, especially in those complex situations.
Exactly. It's about creating a culture of ethical decision-making where everyone feels comfortable voicing concerns and getting help when they need it.
You know, we talked about postmortem care being a sensitive procedure, But I imagine there are also those practical things CNAs need to know.
Oh, for sure. The curriculum gets into the specifics of how to prepare the body for the family to view and for the mortuary.
Like what specifically?
Things like positioning the body, closing the eyes and mouth, removing medical equipment, making sure the body is clean and presentable, and of course following universal precautions to prevent infections.
So it's about those practical skills, but always with sensitivity and respect.
Exactly. It's about recognizing that even though the person has passed, their body deserves to be cared for with dignity. It's a final act of compassion.
And does the training talk about how post-mortem care might affect CNAs emotionally?
It does acknowledge that it can be difficult and emotionally challenging. It encourages CNAs to take breaks if they need them, to talk to colleagues or supervisors for support, and to recognize that it's okay to feel all sorts of emotions.
Again, it's about normalizing those feelings and helping CNAs cope.
Exactly. It recognizes that they're human, not robots. And caring for dying patients, even in those final moments, can bring up a lot of emotions.
This curriculum seems really thorough in addressing both the practical and emotional sides of end-of-life care. It's not just about what to do, but how to be present and compassionate and ethically aware in those tough situations.
I absolutely agree. It's about preparing CNAs to be more than just task-oriented.
Okay, yeah.
They're being equipped to be truly compassionate companions, advocates, and sources of support for patients and families during an incredibly difficult time.
It's a holistic approach, recognizing the complexity of what people go through at the end of life.
Exactly. Dying is not just a medical event. It's a deeply personal and emotional journey.
You know, it makes you think about how this type of curriculum might change the future of end-of-life care. Do you think this focus on compassionate care and ethical awareness is becoming more common in healthcare overall?
I think there is a growing recognition that end-of-life care needs to be more than just medical interventions. There's a shift towards a more holistic approach, addressing the physical, emotional, and spiritual needs.
So not just extending life, but making sure the remaining time has meaning and comfort.
Exactly. And this curriculum reflects that shift. It's training a new generation of caregivers to approach end-of-life care with compassion, sensitivity, and a real understanding of the human experience.
And this curriculum is part of that movement.
Absolutely.
Training CNAs who are sensitive, skilled, and committed to providing the best care possible for those facing the end of life.
Definitely. It's not just training. It's shaping a more compassionate and humane approach.
Now, we talked about the timeline of life exercise, which seems like a great way to build empathy. Are there any other unique teaching methods in this curriculum?
One that comes to mind is the use of role-playing.
Oh, interesting.
Students get to practice handling tough conversations and situations in a safe environment.
So it's like a dress rehearsal for real-life interactions.
Exactly.
They can practice those conversations about end-of-life options, dealing with ethical dilemmas, providing emotional support.
Exactly. It gives them a chance to apply what they've learned, to work on communication and problem-solving skills in a practical way.
That's a great bridge between theory and practice. I bet it helps build confidence, too.
Absolutely.
Yeah.
They can make mistakes and learn from them without the pressure of a real situation.
I'm also curious how the curriculum handles grief and bereavement. Does it give CNAs guidance on how to support families who are grieving? Or even how to cope with their own grief when a patient dies?
It does. It talks about the different stages of grief and how they might look different for different people. It emphasizes active listening, offering condolences, and being respectful of the family's traditions and rituals around mourning.
So equipping CNAs to provide sensitive support, culturally appropriate support.
Exactly. It's recognizing that their role goes beyond just the bedside. It includes supporting families through a really tough time.
And what about the CNA's own grief? Does the curriculum acknowledge that they're going to experience loss, too?
Yes, it does. It encourages CNAs to acknowledge their feelings, to seek support from colleagues or supervisors, and to develop healthy ways to deal with grief. It also stresses self-care and boundaries to prevent burnout.
So it's recognizing that CNAs aren't immune to the impact of caring for dying patients.
Right.
They need support, too.
Absolutely. It's about recognizing the humanity of both the caregiver and the patient, creating a supportive environment.
It's amazing how much this curriculum covers. We've talked about practical skills, emotional support, ethical considerations, cultural sensitivity, even the CNA's own well-being. It really is comprehensive.
I agree. It goes way beyond just teaching tasks. It's about preparing CNAs to be compassionate, ethical, and resilient caregivers.
And it sounds like they're doing a fantastic job of equipping those future CNAs to make a real difference for patients and families at the end of life.
Absolutely. It's not just training CNAs, it's shaping a more compassionate and humane approach to end-of-life care.
Well said. Now, as we start wrapping up this part of our deep dive, what aspects of the curriculum surprised you or stood out as especially insightful?
One thing that really struck me was the focus on communication skills.
Okay.
It's not just about giving information, but about creating that space for open, honest dialogue,
Right.
active listening, using respectful and easy-to-understand language.
So recognizing that communication is a huge part of compassionate care, especially in these situations.
Exactly. It's about building trust, understanding needs and concerns, and providing support and reassurance.
Does the curriculum give any specific advice on having those tough conversations, like talking about end-of-life choices or dealing with the patient's fears?
It does. It suggests using open-ended questions, acknowledging the patient's feelings, and avoiding giving false hope. It also emphasizes things like maintaining eye contact and offering a comforting touch.
So it's giving them those practical tools for handling emotional conversations with empathy.
Exactly. It recognizes that communication isn't just what you say, but how you say it, especially with these sensitive topics.
We've talked a lot about the emotional demands of this work. Does the curriculum address the spiritual or existential questions that come up too?
It does touch on those, though not in a lot of detail. It acknowledges that patients and families may wrestle with questions about the meaning of life, about what happens after death, and the nature of suffering.
So it recognizes that end-of-life care isn't just physical, it's about the whole person,
Right.
including their spiritual and existential concerns.
Exactly. And while it doesn't get into specific religious or philosophical beliefs, it encourages CNAs to be respectful of their patients' spiritual needs and give them space to express those.
It's about being present, listening without judgment, and offering support even if you don't have the answers.
Precisely. Sometimes the most important thing a CNA can do is just be there, a compassionate presence.
Well said. This has been such a thought-provoking discussion. I'm really looking forward to that final part of our deep dive,
Me too.
where we'll wrap up our look at this incredible curriculum.
There's still so much to learn about the complexities of end-of-life care.
We'll be back soon to continue our journey. And we're back for the last part of our deep dive into the California Community College's curriculum for CNAs, focusing on death and dying. It's really been fascinating seeing how this curriculum prepares future CNAs, not just for the practical side of things, but for the emotional and ethical challenges, too.
It really is a comprehensive approach.
It is.
We've covered so much.
We have.
The stages of grief, the dying person's Bill of Rights, the timeline of life exercise.
It's made me realize just how much goes into providing truly compassionate care at the end of life.
It's not just about medical procedures. It's about understanding the whole person.
Right, their physical, emotional, and spiritual needs.
And recognizing that death is a natural part of life, approaching it with dignity and respect.
Exactly. And this curriculum does a great job of getting that message across.
It does.
So as we wrap things up, I'm curious what stood out to you the most, what surprised you, or maybe even challenged how you think about end-of-life care.
One thing that really struck me was how much emphasis the curriculum puts on self-care for CNAs. Recognizing how emotionally demanding this work can be and encouraging them to make their own well-being a priority, that's so important.
Yeah, you're right. We often focus on the patient's needs, but caring for the caregivers is just as vital.
Absolutely. If CNAs aren't taking care of themselves, they can't provide the best care to their patients.
Burnout and compassion fatigue are real risks in this field, so it's great to see those challenges addressed directly in the training.
It is. It lets them know it's okay to ask for help, to deal with their own emotions, to get support.
It normalizes those feelings and helps create a more supportive work environment.
Exactly. And in the end, that benefits everyone, both the caregivers and the patients.
Now, thinking about the bigger picture, do you think this kind of training will lead to actual changes in how end-of-life care is provided?
I think it has the potential to, definitely. Giving CNAs the knowledge, skills, and emotional intelligence to provide truly person-centered care can have a ripple effect throughout the entire healthcare system.
So it's not just about training individuals, it's about creating a cultural shift towards a more compassionate and holistic approach to end-of-life care.
And I think we're already starting to see that shift happening.
Yeah.
There's a growing awareness of how important things like palliative care and hospice care are, and how important the role of CNAs is in providing comfort and support at the end of life.
And this curriculum is a part of that movement.
Absolutely.
It's training a new generation of caregivers who are sensitive, skilled, and dedicated to providing the best possible care to those facing the end of life.
They're not just caregivers. They're advocates, they're companions, they're sources of comfort for patients and families during a really profound and often challenging experience.
Well said. It's been truly insightful exploring this curriculum with you. We've really delved into the emotional, the practical, and the ethical sides of end-of-life care.
We have.
And it's clear that this training goes way beyond just teaching tasks. It's about nurturing compassion, empathy, and a deep understanding of the human experience.
I couldn't agree more. It's been a privilege to unpack all this with you, to see how much thought and care went into creating this curriculum.
Now, as we wrap up this deep dive completely, I want to leave you with something to think about. Knowing what you now know about the stages of grief, the dying person's Bill of Rights, and how important compassionate care is, how do you think we as a society could approach death and dying better?
That's a great question to consider. There's always room for improvement.
There is.
More understanding, more open and honest conversations about death and dying.
Exactly. And remember, this deep dive was just a starting point. Keep exploring, keep learning, and keep advocating for better end-of-life care.
It's a conversation that deserves our attention and our compassion.
It certainly does. Thanks for joining us for this deep dive.